The Pediatric Lounge, a podcast taking you behind the door of the physician's lounge to get a deeper insight into just what docs are talking about today. From the clinically profound to the wonderfully routine and everything in between. Well, hello again. Welcome to this week's episode of the Pediatric Lounge. This week we will be highlighting women in pediatrics who are entrepreneurs and are happily thriving in their own pediatric practices across the United States. Today, help me welcome Dr. Jennifer Miller, who grew up in Peru, Indiana, graduated summa cum laude from Huntington College in Indiana, then went on to Indiana University to do her MD degree and followed it by being at Nationwide Children's Hospital. Now she is in Lancaster, Ohio, where she is both owner and managing partner of her practice. Welcome also our co-host, Dr. George Rogu, and myself, your co-host, Dr. Herb Bravo. Hi, George. Good to see you again.
Herb, it's Tuesday morning once again, elevating great physicians, and we have Dr. Jenny Miller, another great physician that I met. So let's talk more.
Hi, Dr. Miller. Welcome to the show. How are you today?
I'm great. Thanks for having me.
Oh, it's a pleasure. Thanks for joining us. And we always start by asking our guests, why did you become a pediatrician?
Well, I wasn't really sure in college with my biology major what I wanted to do. And so one summer I did an internship at Riley Children's Hospital Research Center down in Indianapolis and realized research wasn't what I wanted to do either. But they had some great programs down there for people in the internship that let us know about the medical school and how to apply to medical school and get in and those kind of things. So I kind of said, maybe I'll give that a try. And I did, and I got in and realized through all my rotations that I really liked the kids and the babies and would follow the babies on the OB rotations and just pay attention to them and not the moms. And I feel like that's the way a lot of our pediatric people are is, we just like the kids and don't like to deal with all the adult stuff.
Right.
True. And tell us a little bit about your group. Were you the founder of the group?
No, it was founded by Dr. Rhodes and Dr. Harris, who were a married couple. It's probably been 30 or more years ago now. So they hired me in 2009 out of residency when Dr. Harris wanted to retire and step back a little bit. So I kind of replaced him, and then a couple years later became a partner. A couple years after that, became president of the company when I joined, when Dr. Harris or Dr. Rhodes retired at that point. So Dr. Hensley and I, took over at that point. We're the two managing partners right now. And we've evolved a little bit over the years, but right now we have 3 physicians, a nurse practitioner, and a physician assistant.
And technology-wise, do you like technology?
Yes.
Agnostic, or do you hate it?
No, I love it because when I started, we were still on paper charts. It was really hard to read the other physicians' handwriting and, see the history of some of the patients I was still trying to get to know. And that was right when EHRs kind of became a thing, and there was all that government incentives for EHRs and stuff. So I actually helped them research some of the different EHR companies and pick which one we would go with back in 2010. And we've stayed with that company ever since.
Now you went into an established practice. I mean, that's great because they already set up the shingle 30 years ago. You just infused it with new doctor blood and carried the torch. That's really great because there's some culture there from the old practice. Now there's some new blood from yourself and your partner, and you're just expanding and growing as opposed to just making a fancy schmancy brand new office, throwing the shingle up, and then wondering why there's no patients coming. So there is a value to going into a practice.
Mm-hmm. Dr. Harris kind of stayed on as practice manager per se, for a couple of years when he retired and showed me a lot of how to run reports, how to look at things, what some markers of a healthy practice were, and different things like that. Back at that time, I was listening to Chip and Brandon's podcast a whole bunch about, pediatric practice management stuff and markers, and, started following Polly on, pediatric practice management stuff as well. So I learned a lot from them, but I also learned a lot from Dr. Harrison Rhodes on the business side of things, as well as the patient care of,
Probably
side of
that's
things.
why it's successful, because somebody helped you, a mentor.
Yes. Yeah, Dr. Harrison Rhodes were very helpful mentors.
That's very nice. Why did you decide to go? I would call your practice a mid-sized practice. It's not small, it's not large,
Okay.
versus to go work for Riley's primary care office.
Well, I had originally kind of looked at some of the bigger practices in Columbus and the hospital system and things, but knew that I really wanted to get out of the bigger city, live in a small town, and be able to work close to where I lived, have a better relationship with my patients and better continuity of care and those kind of things. So I'm really glad it worked out the way it did, because you definitely have a whole lot more autonomy in a private practice than you do in the corporate settings, and more flexible options with our schedules and vacations and filling in when other people are out and different things like that.
So it's not only successful, but more enjoyable.
Oh, yes, very much so. When I think about some of my colleagues that are working elsewhere.
Doom and gloom attitude out there about private practice. I mean, I'm in private practice. I should be the poster boy for burnout, yet I'm not. I'm happy.
Right.
Oh my
Yeah.
doctors are happy. Why?
I think it's just because so many physicians are employed physicians. Obviously not everybody can be in private practice. There's a whole lot more places that need employed physicians than private practice docs. So the majority are in that position, are burnt out from the demands of the corporate workplace and things like that. And that's all you hear, kind of, just like you said, we need to talk more about private practice and how great it is, and let people know that it's an option and that it's a really great option and why you should do it. And I just don't think there's enough people voicing that opinion out there.
Correct. I think that's the number one reason. And I also think that people, like, you have to do something, you have an idea.
Yeah, that's the way we do stuff all the time. We'll talk in between patients or over a lunch break or a monthly staff meeting, and then we change it right away and we're done.
Yeah, then you move on to the next project.
Yep.
Yeah.
What challenge did you encounter as a small business owner, and how did you solve it? One big one that would be a good lesson for our listeners.
Oh, goodness.
Challenges all day long.
Yeah, some of the biggest challenges as, being a small business owner has been, one, staffing, and two, managing our vaccines, and, how to make sure we're protecting our vaccines because of what a big investment that is. So we've actually had a fridge fail on us in the past and had to install some new safety measures and generators and monitoring systems and notification systems and things like that. So that was a little stressful. And then just the staffing and managing staff, obviously that became more of a problem in COVID. And we've been lucky. We've had some staff that have been with us for 20 years. There's some staff that have been here longer than me. And so we've been very lucky in that respect, that we have a great culture and a good number of staff that are very consistent and loyal. But there's always a few that trickle in and out or move on to other things, and hiring and training and placing and trying to figure out the right hire so that, we make sure it's a good fit for the long term is the biggest struggle for me.
I have 3 questions about that. Do you carry additional liability insurance on your vaccines to protect against those bad outcomes?
Yeah.
Good. Thank God.
Yeah.
That's a big chunk of change, right?
Yes, it is.
Do you have any trainer videos for your staff? Because the front desk seems to always be a revolving door, and I understand it. They get it from all sides. It's just, I can't imagine sitting in the front desk for more than 2 weeks before you just become an alcoholic. It's they get it from the doctors, they get it on the phone, they get it from the doctors that are calling to talk to the doctor, they get it from patients. It's not an easy job. Do you use any training videos or anything like that?
We don't. And, I don't know if that's part of the problem or not, but all of our training is just peer-to-peer training for the most part. There's some things on the EHR that will teach you how to do things on the EHR, but a lot of it's peer-to-peer.
What do you use?
But we use Office Practicum.
Yeah. Have you implemented any interfaces or connections with office practice?
Yeah, at one point we had a connection with the hospital to be able to import labs and different things. And then that connection went away, I think, when the hospital changed EHR systems and things like that. So we're still working on trying to get some of those functionalities back. But right now it's mostly faxes and scanning and inputting and things like that with our EHR.
Is really, really well. We have office practicum also.
Yeah.
It's really, really good for like connections with other things or getting the data out to put into other things. Because it seems to be, my interpretation, like one massive spreadsheet.
Yeah.
Basically, and cells, and that's what they're looking for.
Right.
But, it requires some smart stuff.
Yes.
In my practice, we had to hire a lot of people. There came a point where I just set up a system. Have you created a system to hiring people to see if it makes a difference?
No. So if you would like to share your system with any of us, that might be helpful. We have our kind of standard way we go about looking for people in phone interviews and then in-person interviews. We do a half-day kind of shadowing after the interview to see how the staff interact and like the person and how they like us. That kind of thing is our informal system, but we don't have anything formal written down.
So I think I did resolve that problem. You know where the best a staff member is? It's in your examination room. You know how many people I have found from the examination table? They're in college. They're the bigger kids. What are you doing? Well, I'm doing medical assistant school. I'm doing nursing school. So the ones that are doing nursing school, I said, here's my email address. When you graduate, I will give you your first job. You interviewed them already. We have so many, and they were the best ones. But the old culture in the office was, we will never hire a patient.
Really? That's interesting, because some of our favorite employees are the parents of our patients, actually.
Well, the parents of the patients. We've also used, I put a little ad on Facebook, on the Facebook group of our practice. We're looking for some nurses or some medical assistants or secretaries. Anybody looking for a job, send us a resume. It works. We got the best pool of employees.
Yep.
So, because I got so frustrated with that, turning of the front desk, it's just it's exhausting when you're running a business and having to retrain people constantly.
Yes.
Yeah.
So I read a book called Who, and it's a great book about hiring. And it's not a very long book, but basically you were to distill it to the essence of it is start with a scorecard. Don't go hire an employee until you know exactly what you're going to measure on that employee. That way, the person, when they're interviewing, they know what's expected of them, and they're not surprised when you sit down with them 6 weeks into the job. These are the 6 things I wanted from you on the front desk. This is where you're not performing where I want you to be performing. We'll talk about it again in 90 days. That I found very helpful to hire with a scorecard in mind. And there's an aptitude test, which I think is better than the DISC assessment. It's called the Canoe Inventory, or the 5 bats. It tests for 3 things. One is how neurotic you are. You might think it's not important, but if you're an OCD person that needs to wash their hands after every patient greets you and leave the front desk, well, that's really difficult because, you're not going to be able to be successful. Well, that's not good, right?
Right.
But it also, what are the other 2 very important is conscientiousness. You want to hire somebody that's very high in the conscientiousness index because they're going to be responsible. They're going to be there 5 minutes before the doors open, not 15 minutes after you open. So conscientiousness is a big key. And the other one is very interesting, agreeability. So you want to hire people that are very agreeable because you want to train them into your culture. And if everything you say is, no, that can't be done. But no, that's impossible. No, I don't want to do that. And it's a very simple test.
Doctor traits.
Yes.
Yeah.
Yes.
Yeah.
Yeah. But I found that you can buy it online for $19.
I'll have to look that up.
Yeah, I'll send you that in an email. So how do you define a leader in medicine?
I mean, I've read a lot of leadership books and things in the past, and I just feel like it's somebody who, you know, almost is like a servant leader, because I mean, we go into medicine to help other people. Same thing, when you're a leader and you're helping other people, you're trying to train your employees, work with other people well. I just feel like leading by example and leading by serving others is the best example of leadership, compared to, the loudest voice is who's in charge.
Yeah,
Yes.
well, that happens in medicine a lot. The loudest voice is who's in charge, and he's not the best leader.
Right.
What I've learned with leadership is you got to lead by example, of course, but I often find, like, even with my partners and other organizations and things, I kind of like know what the answer is. So rather than tell you we should do this, I'll dance around the discussion a little bit for you to decide we should do this.
Yeah.
Come back with my answer that I already knew half an hour ago. But it seems to work a little bit better if I get buy-in from another physician as opposed to telling another physician what to do. They don't like being told.
Very true. Especially those of us that are our own bosses already, and owners or partners and things like that. We don't like to be told what to do anymore.
You're not small, you're not huge, you're mid-sized, you're a nice size. By systems or hospitals or networks to come on, let us take care of all the stuff you don't like. You just do what you ever do best, be a doctor.
Yeah, we discussed that at one point with a big primary care organization here in Ohio, and just decided that it wasn't the right time. We still like being very independent, even though they said we'd still maintain a lot of independence. We wanted to make sure we were also being very profitable too, and not compromising on that. And so we kind of decided against it and left it as maybe a backup option in the future for when we want to retire. If nobody's buying the practice or has become a partner by that point, maybe that's a good backup option. But for us, it's just not where we see ourselves going.
Good move. I think for a practice to survive into the future, I mean, there's something to say about your practice. It's been around for a long time.
Yeah.
And what brought it to the next level was new blood. I think you need new partner blood like every 10 years.
Yeah, and that's about the trajectory we're on. Dr. Hensley was 10 years before me and is still here. I came 10 years later. I don't know how things are going to work in the future. We have another hire. We just, it's been about 12 years that I've been here. We just hired another physician that hopefully will work out for the long term, because we've had a few that haven't worked out for the long term in between, but that's good spacing in my opinion too.
How do you decide if a physician, because not every physician, I can tell you, is the partner material.
Right.
Most are not.
Yeah. Yeah. The things we look for are good fit with us as our practice culture, but good fit for the community too, because that's part of our practice culture, is we live and work in the same community and have a lot of connections in our community. We donate a lot and are involved in a lot of the local organizations, and we want somebody that fits into the practice that would carry that forward.
Well, they have to have some talents.
Yeah, obviously, good skills and drive and things like that too.
I mean, just showing up to go to work with my doctor MD, it's not enough.
Right.
I think that there are room for physicians that just want to see patients and physicians that want to manage.
Yep.
You need both. Perhaps the rub there is physicians that see patients never want to value the work that the managing partner is doing, because they're seeing patients and they're putting a lot of time to keeping the wheels of the franchise on and the engine running. And
not easy.
That creates some conflict, but there should be no conflict. If all I want to do is see patients, I get paid for that, and I shouldn't begrudge anybody for taking the morning off to do contract negotiations.
Right.
It's at the end of the day that brings more money into the practice.
Correct.
Yep.
What have we not asked you that you think is important for our audience?
I think the biggest thing is just knowing that it's possible to have a successful private practice, that you can manage yourself and there's plenty of support out there for you. And, plenty of doctors like us who are happy to help you along the way to, start a new private practice or join an existing private practice so you can learn from some of us who have been doing it a lot longer, that's a very viable option and a very good option for those that are not wanting to work for the big corporations and worry about burnout as much.
You know what I found very interesting? Doctors tend to be busy all the time or make themselves look like they're busy all the time. Example, how did we meet for this podcast? On one of the Facebook groups, right? I posted something looking for elevated. The amount of chatter that was on that Facebook group was amazing. Yet, do you know how many people I booked? You're the only one.
Really?
You're the only one.
That's very surprising to me.
Yeah, I'm busy. I got this, I got that. Maybe next year I'm not ready to put this out. Loads and loads of excuses. It was actually disturbing.
Yeah.
So there was a lot of chatter.
I think people sometimes don't always have their priorities right, and you make time for what's important to you.
Yeah. I mean, I think elevating private practice is very important.
Yeah.
It didn't take too much time to have a podcast between the three of us.
I think it's very important to take time and talk to other colleagues and share ideas. And there's less and less meetings in person to go to for CME.
Yeah.
It's more complicated. People have young children and travel arrangements and practice arrangements. And it's, you lose a lot of that ability to re-energize, get new ideas and come back to the practice and implement them.
Yes.
Which is a shame. What are you reading today?
Well, the most recent things I just finished was a fiction book called The Silent Patient about a psychiatry ward that was really interesting. And before that, the nonfiction book, Entree MD Method by Dr. Una, that was a good one too. I like her podcast.
Dr. Una on the podcast.
Yeah. She's great too.
And this fiction book about the psychiatric patient.
Yeah.
What's the story?
It was an interesting story with a twist at the end about a woman who was accused of murdering her husband and then basically refused to speak and was silent for 7, 8, 9 years, whatever, and put in the psych ward because of her refusal to talk afterwards. And a psychiatrist that tried to, took a job there just to try and get to the bottom of her story and what was going on.
Oh, wow. That's very interesting.
Yeah.
Very interesting. Well, thank you so much for being on the podcast today. Really enjoyed this conversation.
Yeah. Thanks for having me. It was great.
Keep up the private practice good work that you do.
Thanks.
We hope to see you soon again.
Yes. Hopefully at a pediatric meeting somewhere.
Yes, that would be excellent.
We'll be there.
All right. Thanks.
All right. Bye-bye.
Bye.